If you're only doing the 5 rights of medication pass, you may not be doing enough. I'm Tanya, my favorite new nurse coach, also your nursing bestie. I'm here to teach you how to build your confidence and your skills in your first year of nursing, but I'm really teaching you how to document because I'm finding a lot of people still are having some learning curves that need to be adjusted for documentation. So today we're going to be talking about the 5 rights. It's now the 10 rights of nursing, of medication pass. So in nursing school, you've been taught the 5 rights, right? We know all of this: the right patient, we know the right med, the right route, the right time, and the right dose. We know all of that. That's kind of like drilled into our heads. But what you may not realize that also has to be in your documentation is a few other things, okay? Primarily, the 6 through 10 are going to be what's recommended by multiple state boards of nursing and also different research panels to ensure the safety for the patient. So number 6 is going to be the right education. So for your patient, you need to show in your documentation that you educated the patient on the medications, the side effect of the medications, and then also when they need to report to any kind of medical professional in case they're having any adverse side effects, any allergic reactions. You have to put that, you're educating them on when they need to seek emergency help. Number 7, you also have to do ding, 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 the right documentation. So you have to show that you are documenting that you gave the medication after the medication was given. Now, I've practiced as a nurse for almost 2 decades. I know how it is sometimes. Depending on what setting you work in, you may give the medication, you may sign out the medication before you give it because you're like, okay, Mr. White always takes his aspirin, so I'm just going to go sign out the aspirin. But then you go in there, Mr. White now says he doesn't want to take the medication, right? So now you have to go in and rescind or go ahead and change the documentation, which we talked about in previous videos. So the best way to do medication administration is to follow the policy, do all the rights, scan out the medication if you work in a facility that uses a scanner, and make sure you're documenting it after the medication has been administered. Number 8, you also have to document if the patient refuses the medication. So the patient has the right to refuse. As long as the patient has a mental capacity to make that decision, and the only persons that can determine that is the court, okay? The judge can determine the capacity of the patient. So as long as it's deemed that the patient has the capacity, the mental capacity to make decisions for themselves, they can refuse to take the medication. And they can refuse it even if it's going to, save their life or decrease morbidity and mortality. They have the right to refuse that. You have to document that, but they have the right to refuse that. So you have to ensure that you have the patient's consent to give medications. You can't just give them something without their consent. And so typically we may not realize that we're doing this, but when you go in and you say, Mr. White, I'm going to give you your aspirin. It is an antiplatelet. You're taking it because you had a stroke in the past and the doctors just want to ensure that you don't develop any strokes in the future. So that's why you're taking the aspirin today. Is that okay? Right? So that's a form of consent. The other thing you have to make sure that you do is that the patient has to the right to refuse the medication, as I said before, but you have to also document that you educated them on the risk and benefits of such refusal. Number 9, you also have to document the right assessment. So if I'm giving a patient, pain medication, if I'm giving Dilaudid 0.2 milligrams PO as needed for, pain, you have to also put the correct assessment. You have to put a pain assessment. On a scale from 0 to 10, they may be experiencing a pain level of an 8. And so again, you have to put the correct assessment for whatever medication that you're given. You have to check that the patient actually needs this medication, right? So with the example of Dilaudid, what if the patient only has a pain of a 2 out of 10? Well, Dilaudid may not be appropriate for that particular pain level. Typically from 0 to 5 on a 0 to 10 pain scale, you typically give more of the acetaminophen, right? You're not going to go to the big boys and go to Dilaudid. So you have to make sure that the medication is appropriate. And then also you want to make sure you check the baseline observations. So in addition to the pain scale, you're going to also make sure you document their vital signs, including their heart rate, their respiratory rate, because we know that opioids are going to decrease their respiratory rate. So you want to make sure that you have their respiratory rate documented. And ding, 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 if their respiratory rate is less than 10, we know that you're not going to give it, even if it's 14 or so. I'd pay attention to the dose, okay? But you're going to make sure that you're documenting these things appropriately. And lastly, you have to document the correct evaluation. So now you have to go back in and show that you reassess the patient for their pain, and now their pain has decreased to, say, a 6 out of 10, or it might have been unchanged, and now we may need a different medication in order to alleviate their pain. So you have to document that you're doing ongoing evaluation, and also ensure that the medications are reviewed regularly to make sure that medications that aren't needed anymore aren't on their MAR, and also that it's going to decrease polypharmacy. Like and follow for more. And please remember, if you need help with documentation, to go ahead and get my guide, which is linked below.